PEP stands for Preparatory Education Program Understanding Pain. There's a lot of people, it's a growing problem in our community, that there's a lot of people that have chronic ongoing pain, they've had it for years and years. And sometimes what's not understood is that the pain is a perception thing, and that it may well be that their problem is with the pain system now as much as with actually any particular tissue damage that was there at the beginning. The PEP program was a result of quite a lot of work that we did to basically, there were some issues that we had in our service around the chronic pain population or chronic pain referrals that we were receiving, more and more of them to our particular service on one side. The other side was with those clients coming is that we weren't really keen for people to have to wait a long time. In the health area often there's a waiting time in these sorts of areas, and we wanted to do something about that to give clients that already had chronic ongoing problems some sort of information or some sort of help, perhaps a bit earlier in their journey, which we hopefully would help them down the track. So that was two things. The third part was that we had a mix of very experienced, terrific, experienced clinical staff, but also we have a flow through of some more junior staff that were perhaps having to see some of the more complex clients and didn't have perhaps the skills or the experience to manage them as well. So they were probably the main things around why we needed to implement some change. And PEP Up, I suppose, was a result of that where we journeyed from there. We implemented things like looking at how the intake of our clients, whether we're getting them to the right clinics and right services, and also upskilling our junior staff by having them spend some more time with our more senior staff and so on. And then as it culminated in then having this intake program, which we call PEP Up, which was based loosely on a program that had already been started in Fremantle called STEPS. So we did a bit of benchmarking with them and then adapted a program that already suited Bendigo Health, and hence we have what we now have today as our PEP Up program, which has been running now since last September. The program now as such that's running is not a trial any longer. We run that weekly. The original program that we were talking about as far as the quality work that we did was once the team had come up with what they thought was a good outline or program for the PEP Up program, it was seen that it would be really important to get the consumer's point of view, see what people thought about it, to see if it was going to meet the mark. So basically we got them involved. One of the people in that team, we had a working group, decided that we should contact the Chronic Pain Support Group, which is a group that exists in Bendigo, and we asked them to supply some members as well as some other clients, and they then attended the PEP Up program. So there was about 10 to 12 of those that actually attended that initial pilot program. At the end of that 2-week course, we got extensive feedback from them. Early indications are that it may even affect our length of stay in one of our in our complex orthopaedic clinic. That it might be that it's looking like that clients are actually staying in our service less time, the ones that are doing PEP Up than before. It's a bit early to say categorically that's accurate, but it's an early trend that's showing us. So that's what we're doing as far as evaluating. It's just part of the journey. It's not the whole answer for everyone. It's just, we call it like it's opening a door. It's opening a door for people to just perhaps see things a little bit differently than they might have before, and then they may go on. That might be all they need, but then they may go on and have other programs that we run. Since we started officially, since September, I think there's something like 150 to 160 people who have now completed PEP Up program, and we've had some fantastic feedback from the clients ever since. And at the end of every program, the clients complete a satisfaction or evaluation, and we've been getting amazing feedback from that. Things like 90% or so satisfaction, and people a huge amount who are actually making changes to their life. I'm very proud of my staff. They've done a fantastic job. I think one of the real benefits of this too is that the training our junior staff get by actually shadowing the experienced staff doing the program. Then they actually do the program themselves. They learn to take it. Then they rotate and they spread the information through the hospital where they rotate to. Because a lot of this chronic pain information is newish, and there's lots of areas that people, even in the healthcare areas who work there, aren't perhaps aware of this type of approach that we should be having with pain. And we're at the end of the line where we work really. It's really the language, it's really the sorts of things, the understanding that we give anybody when they first get injuries and first have problems that really is important in helping them end up not being in chronic pain. So the opportunity to actually spread this news, or spread this information if you like, this knowledge that these junior staff get, I think is really one of the highlights of it too.